You may think that the more health checkups you do, the safer you are. But the truth is far more complicated, especially after the age of 70. Many seniors believe that frequent testing will protect them from disease. Yet, what I have seen in practice is that certain routine checkups can actually cause more harm than good. Instead of giving peace of mind, they bring unnecessary radiation, false alarms, invasive procedures, and even dangerous complications from anesthesia or surgery. I have seen older patients go through biopsies, hospitalizations, and treatments that were never truly needed, all triggered by a test that should not have been done in the first place. The tragedy is that these harms are preventable if you know which tests to avoid and what safer options to choose. In this video, I will reveal the 5 health checkups that seniors over 70 should think twice about, why they may bring more risks than benefits, and what alternatives are safer and smarter for your health. This is not about ignoring your health. It is about protecting it by choosing wisely. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. And if you enjoy this video, type 1 in the comments. If not, type 0 so I know how to make better content for you. Part 1. Full body scans, the silent radiation trap. The first checkup that many seniors believe is protective, but often turns out harmful, is the full body scan. On the surface, it sounds appealing. A single test that looks at your entire body, promising to catch diseases early and give you peace of mind. But the truth is that these scans, often done with CT or PET technology, expose you to high doses of radiation that your body does not need if you have no symptoms. Radiation is cumulative. Every scan adds to the lifetime risk of developing cancer. And at age 70 and beyond, the benefits of such broad BA, untargeted scanning rarely outweigh the dangers. Another hidden danger of full-body scans is the false positive effect. These machines are so sensitive that they often pick up harmless shadows, benign nodules, or small variations in tissues that have no medical significance. But once these findings appear on a report, the chain of events begins. Doctors order more scans, invasive biopsies, or even surgeries, all of which carry real risks. I have seen patients go through painful procedures only to discover that the abnormality was never dangerous in the first place. Beyond physical harm, the psychological toll is heavy. Seniors who undergo full-body scans often live with weeks or months of anxiety waiting for test results, worrying about cancers or diseases that may never have existed. Instead of peace of mind, the test delivers fear and unnecessary stress. The smarter approach is targeted screening based on individual risk. If you have specific symptoms, or if you are at high risk for certain conditions because of family history or past medical problems, your doctor can order the right test for that purpose. But blanket full-body scans without clear reason are more likely to cause harm than to save lives. The lesson is clear. After 70, resist the temptation of full-body scans marketed as health insurance. They are not insurance. They are radiation traps that can quietly damage your health and lead you down a dangerous path of unnecessary interventions. If this has surprised you, wait until you hear about the next checkup. Routine colonoscopies, which may also become more harmful than helpful after 70. Part 2. Routine colonoscopies, risk may outweigh benefit. The second checkup that must be reconsidered after the age of 70 is the routine colonoscopy. For decades, this procedure has been praised as the gold standard for detecting colon cancer. And indeed, for adults in their 50s and 60s, it has saved many lives by finding and removing dangerous polyps. But once you reach your 70s, the balance between benefit and risk changes significantly. Colonoscopy is not a harmless test. It requires sedation or anesthesia, both of which carry higher risks in older adults. Complications such as low blood pressure, irregular heart rhythms, or even breathing difficulties become more likely as the body ages. The procedure itself involves inserting a long tube through the colon, which in some cases leads to bleeding or even perforation of the bowel. While rare, these complications are far more dangerous in seniors, often resulting in hospitalization, surgery, or long recovery periods. Another important point is that colon cancer is slow growing. If you have had regular colonoscopies earlier in life and they have been normal, the chance of suddenly developing aggressive colon cancer after 70 is relatively low. Continuing to repeat the procedure every few years often exposes you to greater danger than the disease you are trying to prevent. For many seniors, less invasive alternatives provide sufficient protection. Stool-based tests such as the fecal immunochemical test or stool DNA testing can detect hidden blood or abnormal cells without the risks of sedation or perforation. These tests are simple, done at home, and while not perfect, they can alert your doctor if something truly concerning is present. The key is individualized decision-making. If you have a strong family history of colon cancer, or if you have had precancerous polyps before, your doctor may still recommend a colonoscopy even after 70. But for most older adults, especially those with other health issues, the risks outweigh the benefits. I have seen seniors who underwent routine colonoscopies out of habit, only to suffer serious complications that affected their independence for the rest of their lives. The goal of screening is to protect life and health, not to add avoidable danger. The lesson is simple. After 70, routine colonoscopies should no longer be automatic. Instead, decisions must be guided by your history, your current health, and a careful discussion with your doctor. Smarter, safer alternatives exist, and for many, they are enough. If this perspective has made you pause, wait until you hear about the next checkup. Prostate cancer screening, which often leads to overtreatment and unnecessary suffering in older men. Part 3. Prostate cancer screening, the overtreatment dilemma. The third checkup that seniors over 70 must reconsider is prostate cancer screening, especially the blood test known as PSA, or prostate-specific antigen. At first glance, PSA testing sounds like a smart way to catch cancer early, but the reality is more complicated and far more dangerous for older men. The problem is not that PSA testing finds nothing. In fact, it often finds too much. Many older men develop small, slow-growing prostate cancers that will never cause harm in their lifetime. These cancers can remain quiet for years, never spreading or threatening survival. Yet the PSA test cannot easily distinguish between these harmless cancers and the rare aggressive ones. As a result, countless men are diagnosed with cancer that did not need to be found. Once the word cancer appears on a report, fear takes over. Patients and families feel pressured to act quickly, and that often leads to invasive biopsies, surgeries, or radiation treatments. These interventions carry significant risks. Prostate surgery can lead to incontinence, leaving men unable to control their bladder, or erectile dysfunction. permanently damaging quality of life. Radiation can cause bowel problems, urinary issues, and fatigue. I have seen patients who were otherwise healthy in their 70s lose independence, dignity, and joy because of treatments for cancers that would never have shortened their lives. The medical community calls this overtreatment, and it is one of the greatest dilemmas of prostate cancer screening. At younger ages, when life expectancy is longer, the balance may still favor detection. But after 70, when the risks of intervention outweigh the slow, natural progression of most prostate cancers, the harms often surpass the benefits. This does not mean ignoring symptoms. If an older man develops urinary problems, bone pain, or unexplained weight loss, he should be evaluated carefully. But routine PSA testing in men without symptoms can open the door to harm rather than protection. A wiser approach for seniors is watchful waiting or active surveillance when appropriate. Instead of aggressive testing and treatment, doctors can monitor for changes and act only if the disease shows real signs of progression. This protects both longevity and quality of life. The lesson is clear. Not all cancers are the same, and not all screenings save lives. For men over 70, routine prostate cancer screening often creates more problems than it solves. If this truth has surprised you, wait until you hear about the next checkup, mammograms and breast imaging in older women, where the danger of false alarms can also outweigh real benefits. Part 4. Mammograms and breast imaging, the false alarm effect. The fourth checkup that must be reconsidered after 70 is the routine mammogram and other breast imaging tests. For younger and middle-aged women, mammography has saved countless lives by detecting cancers early when they are most treatable. But as women age, the balance of risk and benefit shifts. After 70, routine mammograms are more likely to create fear and unnecessary procedures than to prevent death. The biggest problem is false positives. Mammograms are sensitive but not always specific. They often pick up tiny spots, calcifications, or shadows that turn out to be benign. Yet, once they appear on a report, the next step is usually more imaging, biopsies, or even surgery. Each of these brings risk, from bleeding and infection to scarring and psychological distress. I have seen older women put through weeks of waiting, painful biopsies, and enormous anxiety, only to be told in the end that there was no cancer at all. At an age when peace of mind is precious, this cascade of false alarms can be devastating. Another issue is overtreatment. Some breast cancers found in older women grow so slowly that they would never cause symptoms or shorten life. Yet once detected, they are often treated aggressively with surgery, radiation, or chemotherapy, each of which can carry severe side effects. Frail patients can lose strength, independence, and quality of life as a result of treatments they may not have needed. It is important to note that this does not mean older women should ignore symptoms. If a lump, nipple discharge, or skin change is noticed, prompt evaluation is essential. But the practice of routine mammograms every year or two after 70, especially in women with no strong family history or prior cancer, often brings more harm than protection. A more balanced approach is clinical breast exams performed by a doctor and self-awareness of changes in the breast. These strategies focus on responding to real problems rather than searching for unlikely ones. The lesson here is that screening is not one size fits all. The same test that saves lives at 50 can create unnecessary suffering at 75. Each decision must be personalized, based on overall health, life expectancy, and individual risk. If this makes you think differently about routine breast imaging, wait until you hear about the next checkup, routine cardiac stress tests, which can also lead to unnecessary risks when performed in seniors without symptoms. Part 5. Routine cardiac stress tests, unnecessary risks. The fifth checkup that many seniors continue to undergo but often should avoid after 70 is the routine cardiac stress test. This test, sometimes performed on a treadmill with heart monitoring or with imaging such as nuclear scans, is designed to look for blocked arteries and predict heart disease. It may sound logical to check the heart regularly, especially since heart disease is common in older adults. But in seniors without symptoms, routine stress testing often leads to more harm than benefit. The problem begins with false positives. Stress tests are not perfect, and in older adults with stiff arteries, arthritis, or limited ability to exercise, the results can easily appear abnormal even when there is no dangerous blockage. Once an abnormality is found, doctors often feel compelled to order more invasive tests, such as cardiac catheterization, which carries risks of bleeding, stroke, or kidney damage. In many cases, this cascade of testing ends in procedures like stent placement or bypass surgery that were never truly needed. These interventions may help in patients with clear symptoms such as chest pain, but in symptom-free seniors, they do not always improve survival and can significantly reduce quality of life. Another overlooked risk is the stress test itself. For some seniors, walking or running on a treadmill with electrodes attached can trigger dangerous heart rhythms, falls, or injuries. When nuclear tracers are used, radiation exposure adds another unnecessary burden. I have seen patients undergo stress tests simply as a routine check, only to end up in the hospital with complications from follow-up procedures. Meanwhile, their original quality of life was good and their heart was not causing symptoms. The smarter approach after 70 is careful monitoring of real risk factors, regular blood pressure checks, cholesterol management, blood sugar control, and attention to symptoms such as chest pain or shortness of breath are far more valuable than blanket stress testing. If you feel well, I can walk comfortably and have no signs of heart disease, a routine stress test is unlikely to benefit you. But if you develop warning signs, your doctor can order targeted tests and treatments that are truly necessary. The lesson is clear. More testing does not always mean more protection. In fact, in seniors, routine cardiac stress tests often open the door to unnecessary risks. Choosing wisely means focusing on prevention and symptoms, not on tests that may create problems. If this perspective has surprised you, stay with me for the conclusion, where I will tie together all 5 checkups and explain why avoiding unnecessary testing is just as important as getting the right tests at the right time. Conclusion: choose the right tests. Avoid the wrong ones. We have now come to the final message, and it is one that can protect both your health and your peace of mind. After the age of 70, not every test that sounds protective truly helps. In fact, as we have seen, 5 common checkups may bring more harm than benefit if done without a clear reason. Full body scans expose you to silent radiation and a cascade of false alarms. Routine colonoscopies can carry more risk than reward, especially if your previous screenings have been clear. Prostate cancer testing often leads to overdiagnosis and overtreatment. leaving men with complications that rob quality of life. Mammograms and breast imaging at this age create anxiety and unnecessary biopsies from false positives. And routine cardiac stress tests can push seniors into risky procedures without proven benefit. Each of these examples carries the same lesson more. Testing is not always better. Screening should never be automatic. It must be thoughtful, guided by your health history, current symptoms, and life expectancy. The tragedy I see far too often is seniors harmed not by disease but by the interventions triggered by unnecessary tests, hospitalizations, surgeries, infections, and long recoveries can take away independence in ways the disease itself might never have done. But here is the hope. You still have the power to protect your health by choosing wisely. Focus on tests that are proven to help at your age, such as blood pressure checks, diabetes monitoring, cholesterol levels, and vaccinations. Pay attention to your body and report new symptoms promptly. Build habits that lower your risks every day. A balanced diet, regular movement, stress management, and avoiding smoking. These steps give more protection than any unnecessary scan ever will. And most importantly, have open conversations with your doctor. Ask whether a test is truly necessary for you, whether the results will change your treatment, and whether the potential risks are worth it. These questions are not signs of doubt. They are signs of wisdom. At 70 and beyond, your goal should be to live with strength, independence, and peace of mind. Protecting that goal requires not only the right medical care, but also avoiding the wrong interventions. So let me leave you with this. Your body still remembers how to heal, and your health can still be safeguarded. But only if you choose wisely. Share this video with someone you love, because avoiding unnecessary harm is just as important as seeking care when it is needed. Now, I would love to hear from you. Which of these 5 tests surprised you the most? And which one will you discuss with your doctor? Comment 1 if you learned something valuable today. Or comment 0 if you want me to make better content for you. And do not forget to like, share, and subscribe so you never miss another health tip made just for you.